Hello, today I'm going to talk about the practical aspect of urinary tract pathology. I'm only going to touch on just a few pathology that are required to be known by the Part 1 Master of Pathology, especially in the anatomic pathology posting. The first one is the clear cell type of renal cell carcinoma. So you can see in this picture, there's groups of cells that has a clear cytoplasms. So just to highlight to you that this one is one cells. You can see that this is the nucleus. I will find out the nucleus, which is I circle this yellow part. So this is the nucleus. So you can see that the cytoplasm, which I mark blue here, is clear. Means there's no structure seen within the cytoplasms, just clear, as white as the space, surrounding space there. As you take a look further, it has more or less homogeneous kind of lesions, showing almost similar structure throughout the slides. You can see that there's also fibrovascular septae, the one that I highlight in red color here, and also here. So you can see within this fibrovascular septae is the blood vessels. So you can see the red blood cells within the vascular layer. So all of these structure within this is actually the red blood cells, the one that colors red. As you zoom in, you can see that this cells has almost mild to moderate kind of nuclear pleomorphisms. So you can see the nucleus of the cells, like here, 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 and a few nucleus here is almost the same size and shapes. So it does not have that very pleomorphic kind of nucleus. And the most important thing that if you wanted to say that this is a clear cell type of renal cell carcinoma is the, as I mentioned previously, the cytoplasm. This is one cell. The nucleus is not within this section, but if you can see, I demonstrate you here, is one cells, and the yellow circle in the center here, I circle with the yellow ink, there is the nucleus. And again, as I mentioned previously, the cytoplasm here is clear. It has a clear cytoplasm. It does not have any structures or tissue or granules or anything within it. It's just clear whitish in color. So this is what make it this is a features what make it as a clear cells renal cell carcinoma. Next we go for the chromophobes renal cell carcinoma. So if you can see within this field, it almost similar with a clear cell carcinoma, the arrangement, the architecture of the tumor. But what most striking here, instead of it has the cytoplasm is clear in renal cell carcinoma, in this type of tumor, the cytoplasm is a little bit granular. You can see on the other aspect of the fields of the of the slides, you can see it almost appear to be like homogeneous with some blood vessels in between it. When you take a higher magnifications, you can appreciate more that the cells has a very granular kind of cytoplasms. So if you stay with me, so let's see, this one is a one tumor cells. So again, yellow as the nucleus at the center there, but take a closer look at the cytoplasm, which I marked with a blue line there. The cytoplasm is a bit granular in compared to the clear cell carcinoma. The clear cell carcinoma, clear cell type of renal cell carcinoma will have clear cytoplasms. So in the chromophobes, because of the presence of these granules within the cytoplasm, so it is usually what distinct in between the clear cells and also chromophobes. So this is a chromophobes renal cell carcinoma. So you can see the granules granular of the cytoplasm. So it's just a pinkish cytoplasm, pinkish granules within the cytoplasm. The nucleus is somewhat mild to moderate pleomorphics. It does not show any marked pleomorphisms. Next is the Wilm's tumor. So what are the components of Wilm's tumor? So for a refreshment. So what is the component is, the first one is the fibroblast type of cells. Number 2 is the glandular formation cells, the first cells that form glands, which has a central lumens that are surrounded by the malignant cells, and the outermost part, not outermost, the other component is the blastema, which are the immature type of cells, which has a very hyperchromatic nuclei. So at this area you can see just stroma cells, which consists of lots of fibroblast-like cells here and there, including this area. So you can see just all of these just the fibrocytes or fibroblasts or the stroma elements of the tissue. As you go towards the other end of the fields, you can see this type of cells. So this is what we call a blastema kind of features. So it's a bit hyperchromatic nuclei. You cannot see the intercellular margins or the cellular outline of the cells. What you can see is just a very hyperchromatic kind of nucleus. They are interspersed with together. You cannot differentiate or delineate the the cytoplasmic outline or the cell membrane of the tumor cell. So this is how a blastema looks like, and unfortunately in this case there's no tubular formations, but the diagnosis is made based on the presence of two types of cells and also a few immunostains. Maybe you can have a look what kind of stains that are positive in to diagnose nephroblastoma or Wilm's tumor. Again, this field is the same. It is just the blastema component of the Wilm's tumor. Next, we go to transitional cell carcinoma, or in this case, is invasive type of transitional cell carcinoma. So, because this is a biopsy or a TURBT, transurethral resection of tumor, so we cannot see properly the invasions or the transition from the normal to the malignant cells. But what we can see is all fragments of malignant tumor. So you can see all of this is the um, the malignant tumor. Here is another cluster, and here is another cluster. So they are arranged in cluster, and as you can see, these tumor cells has moderate to marked pleomorphisms, nuclear pleomorphism, and the nucleus appeared to be more of hyperchromatic kind of features. Go into the other fields of the slides. You can see almost similar features. The tumors are arranged in clusters, like so. This is another cluster, but it's a little bit crushed. So you can see in between these tumor cells, which I highlighted blue here, is just stromal cells. It's just made up of fibrocollagenous tissue, or sometimes we call it desmoplastic stroma. In this area, you can see there's a very huge cluster of tumor cells. It extends from here and almost occupying almost all of the this field. But what I wanted to show to you is the presence of the pleomorphic or markedly pleomorphic nuclei. So you can see at this area, the nucleus is very small and almost round in shapes. But as you see in this area, the nucleus is sometimes look binucleated. The cells it's binucleated, and this is the nucleus seems like fusing together. This is another large nuclei with prominent nuclei, and this is a very large tumor cells having a very large irregular type of nuclei, and these few nuclei seems like it's fusing together. So you can see this variability in the in this field. So this variability what is somewhat a feature is a features of marked pleomorphisms. Again, in this picture also you can see at this area there's some large irregular type of nuclei, and the rest is just another tumor cells. They are arranged in big large cluster, large, or you can say large groups of tumor cells. And this is just to demonstrate to you how a mitosis looks like. So here is one mitosis. So that is how a mitosis looks like, and it appears to be some sort of irregular type of mitosis. So you can see the chromatin or the mitotic elements is dispersed at the periphery of the cells, and this is a type of irregular or atypical mitosis. And I think this is the last case. It's a chronic pyelonephritis. So under low power, you can see there are some tubules there are dilated. This is area you can see some sort of dilated tubules, and you can see also if you can appreciate, this is one highly nice blood vessel. So this patient is having, apart from pyelonephritis, he's also having hypertension. So this vascular changes due to hypertension. So you can see what's going on to the vessels. It'd be highly nice. It's not a very malignant type of hypertension, but just a very benign or mild type of hypertension. So by time the vessels become highly nice and thicken, which will further constrict the lumen. So as we move towards the medulla, where there's a lot of tubules there, you can see the features looks like a thyroid. Why? You can see all of these things, and this thing dilated with some secretion within the lumen is tubules. It's a dilated tubules. So actually it's a proteinaceous kind of material that are present within the lumen, and it's dilates the lumens, and this is what makes the lumens look like a thyroid. So this is how we see the features of thyroidization. So thyroidization will looks like this. So you can see this is one dilated tubules with some secretion, which I marked with a yellow line there. There's a proteinaceous secretion which resembles the thyroid colloids within the thyroid follicles, and the cells that lines the tubular cells that align the tubules looks like a follicular cells. So that's why sometimes we call it a thyroidization of the renal tubules. So this is commonly seen in chronic pyelonephritis. And apart from that, in this area is a bit lesser, but if you can have a look afterwards, you can find these glass slides in our collection. You can assess the area that are not the tubules. So you can see there will be some inflammation within this area, and also in this area when is a stroma or the supporting tissue. So you can see there's some inflammations there. Because of this is an acute inflammations or acute it's because this is a chronic inflammations. So what you can see is cells that are present in this area, the stroma area, is usually the lymphocytes and sometimes plasma cells. So by that, thank you. You can follow me on Facebook, Instagram, Twitter. You can text me, emails me if you have any questions. So by that, thank you, and till we meet again. Goodbye.